Africa is a continent with many countries of different demographics, different cultures. And so you find that the prevalence of NCDs in Africa differs as you move across the island states, as you move inland, and as you move north, and so on. But Africa has its own specificities, its own uniqueness. If you look at the poverty levels in Africa, they're high, and poverty is known to produce NCDs, and NCDs are known to produce poverty. And so there are so many things that the African states are trying to do to collectively respond to Africa's challenges, including very significant economic challenges, including conflict, which perpetrate so much of the inequities in non-communicable diseases. And so you see, some of these common challenges require that Africa should be able to mount a comprehensive response to NCDs. You see, there is need for concerted effort. There's need for collective thought about how to respond to the increasing burden of NCDs. When member states come together and reinforce each other's commitment, you can now produce a very robust, informed, collective response from member states, from different countries. So once you have the African Union making solid commitments that cut across, then you have member states taking up action at national level, inspiring action at local level. You know, financing for NCDs has become a very, very major topic because when you look at the burden of NCDs and you look at the health budgets within member states that go to NCDs, you realize that there's a big challenge. When you look at universal health coverage, you realize that there is no universal health coverage without coverage for non-communicable diseases. And to work out how the financing for care, for prevention, for NCDs can happen effectively is a huge, complex challenge. I give you an example. So many insurance companies do not have appetite for insuring people against chronic, long-term, non-communicable diseases. In Cameroon, for example, less than 2% of people have insurance. And that should begin to really tell you how NCDs can perpetuate poverty in families. So we need those who are having those experiences to be effectively engaged. Their understanding, their experiences constitute expertise. They constitute data that should help us bring out the kinds of innovative solutions that will inform action, that will bring care to people.